Hello everybody, this is Dr. Emilio Castrillon, and today I wanted to talk a little bit about what we do as chiropractors, what the chiropractic profession is focused on, and I wanted to go straightforward saying we focus on the nervous system. We are the least invasive option to treat and to work with the nervous system as well. So basically, this is how you can identify this easily. So let's talk about symptoms because we were educated, people is educated mostly regarding symptoms. I have this type of situation, so I'm gonna move towards what I can have as a help or resource in order to help diminish or control or heal this situation. So in terms of symptoms, basically pain is an example, is a very common symptom that people use to come to the chiropractors. So symptoms like pain is controlled by the sensory portion of the nervous system. The nervous system in the sensory portion also controls temperature. So maybe you can feel like some areas in your body are kind of cold compared to the others. That's controlled for the sensory portion as well. And something that is called proprioception, or even your posture, that is controlled by the sensory portion as well. So if you have any issues with that, that's directly related to the sensory portion of the nervous system. Also, you can have weakness in your muscles. You try to lift something and then you kind of feel like weakness, and it's like something that you feel and you are sure is abnormal. So that's also controlled by the motor portion of the nervous system. And this is a very good information for you. You have an idea. The last Olympic Games in summer in Rio 2016, the chief of the medical commission was a chiropractor. Why? Because we focus on remove vertebral subluxations, something that is affecting directly the nerve transmissions to control the muscles. So, and this was the first time in history the US made the more amount of gold medals in the history of the Olympic Games, and that's because we focus on remove that feeling when the athletes say, I don't feel today at 100%, I don't feel well, is because the feeling is across the nervous system, and in the terms of the muscle is directly related to the motor control of the nervous system. Okay, also we can get problems in the systemic area, something that is controlled by the autonomic function of the nervous system. For example, if you have a thyroid issue, that could be a hyperthyroidism or hypothyroidism. So that means something is not in control. Everything should be controlled across the peripheral nerves, all of this in the nervous system. And in that case, for example, thoracic number one, these two nerves right here are the main related to control the thyroid gland, which is located right here. So could be related to that. Those are the sympathetic portion of the nervous system controlling the thyroid, or even could be related to another portion which is called the autonomic function across the cervicals or down to the cervical number 5. All of that region is controlled, have direct control over the parasympathetic nervous system as the same as the sacrum. So what I mean with all of this, you need to find the root cause of your problem. We as chiropractors, we focus on the nervous system to find the root cause of your problem. If it's something systemic, for example, a hypertension. I had a patient more than 30 years being on medication for hypertension and still having high levels of hypertension. She was all the time across the 30 years, she was getting more and more and more hypertension medication. That one increases, that increases in the body allow another type of secondary effects like osteopenia. That patient presented with problems in the skeletal system later on. So that's a problem because that wasn't the cause of the hypertension for this patient. After 3 weeks of chiropractic care, this person was able to remove all the hypertension symptoms. She was functional at normal capacity. her body was working properly. So in her case, was a structural problem that was taking control, affecting that control from here, from lumbar number 5, and even in her case, from the thoracic number 2 and 3. So that's critical to identify what the real cause of my problem is. So I have patients, for example, that they have bulging disc or they have herniated disc. We as chiropractors, we can work with that as well. Some people is afraid like, oh, I have these herniations, I need surgery. Wait a minute. The herniation have 6 different stages. So which stage are you right now? So if you are just starting to have this herniation, so you need to have an evaluation. Maybe you can have a chance having a least invasive option first instead of having a surgery that's gonna compromise on other things. So before you go deeper with a treatment that is gonna be super expensive, it's gonna be hard to recover, and it's gonna compromise your integrity, try chiropractic first. I have seen patients even in the final stages of these herniations is almost fused together. Their body is trying to adapt, to heal. That's the nature. If you cut yourself you have a wound, your body is gonna try to heal that. So it's exactly the same mechanism that happens for everything. So that is something that is called innate intelligence. Our body is super smart inside that has that control, but we only need to remove whatever is affecting that, so the body's gonna do amazing things. So that's the chiropractic that I learned, that we know, and that's the chiropractic that we are working in here. And for that reason, we are getting patients from different places. The people driving like 45, 50 miles away. Even have people that is traveling, is people sending patients, their family members from another states. They are coming through here because they are finding solutions to the problems that they were taught that is idiopathic. Idiopathic means they don't know the cause, but then it's important and make total sense to identify in the spine. Check first the spine, and that was the father of the medicine that says for in case of illness, check the spine first, and that was Hippocrates, the one that stated that. So we want to help you to be as healthy as possible, and we focus first on the spine, removing vertebral subluxations. Try to find your chiropractor that you trust, that you believe that is going to help you, and do the examination that is proper for your spine, and treat and remove those in order to identify and improve your quality of life. That's my message. That's what we are doing. That's what we are seeing here, seeing our patients. And for that reason, we are growing. We just started in here like a couple months ago, and we are blooming in here. So we are almost moving out because for real, we don't have space. And that's because we are helping our people, and they are sending over more and more people. They are sending the family members, they are sending friends, they are sending colleagues, they are sending the people that they know that this chiropractic care that we are practicing in here is going to help them to be better. Okay, so this is Dr. Emilio Castrillon from Expressions of Life Chiropractic Center. Check our Facebook page, check also our videos that we have in YouTube. So, and we are here to help you. Okay, so have a great day and see you guys. Bye.